November is Lung Cancer Awareness Month, and early detection can lead to 20% fewer deaths. Some hospitals have early detection screenings for patients. One of them is Wellington Regional Medical Center, and Dr. David Soria from Wellington Regional is joining us now to tell us about it. Doctor, good morning.
Good morning. How are you?
Let's talk a little bit about this screening. It's quick. It only takes, what, 15 seconds?
Yeah, it is real quick.
That's
and
nice.
And they've made it very affordable as well for those where you may or may not meet the criteria indications where your insurance will pay for it. But so what? If you're concerned about it, if you're greater than 55, if you have smoked within the past 15 years, it may be on your mind. You need to talk to your doctor about it, and it may be worthwhile. So for $99, very, very low dose CAT scan can screen for it, and it can put it to rest and give you that peace of mind.
All right, so either way, insurance or no insurance, 99 bucks isn't too bad.
That's it, and this way then you can at least see whether or not you are at risk, and it's very, very sensitive. So if you go through that screening and you get a clean bill of health, you can pretty much rest assured that you don't have any evidence of lung cancer that would require any further treatment for years after that. But of course, if you have been a smoker, it's always good to keep that communication with your doctor. Now, God forbid you find something, Wellington as well as Jupiter are the only two comprehensive lung centers in the county that have everything from soup to nuts for early detection, the accurate diagnosis, and then of course prompt treatment for your lung CA. So, I know it's Thanksgiving Eve, but it is something serious to talk about, and the American Cancer Society has designated November as Lung Cancer Month because people underestimate the impact of lung cancer still. It's still the #1 cancer killer in the U.S.
Wow.
And even though, most of us, you and I, we don't smoke, and we go out and we don't see smokers around us because restaurants have prohibited it, but there's still a substantial amount of smokers. 15% of us still smoke. 36 to 40 million Americans are still out there huffing and puffing. So it's out there. It's important, secondhand smoke and whatnot. So even us non-smokers still are at risk.
Right. And you notice it more, don't you? Because before, it was all around you. Now it's not. So when you smell it, hey, who's smoking?
That's a good point.
Yeah,
that's a good point.
True.
You probably are a little bit more aware.
Yeah.
And maybe because it has been prohibited in restaurants, we certainly have decreased the risk a little bit. But clearly, many of us still smoke, and a smoker is 23 times more likely to get lung cancer than a non-smoker. It's still not negligible for non-smokers, but it's incredibly higher.
Well, you mentioned 15 years. If you smoked within the past, haven't smoked, in the past 15 years, so is there like a cutoff that you get back to almost normal?
Yes. Unfortunately, lung cancer and the beginnings of start many, many years back. So if you've smoked even up to 15 years ago, you are still at risk. You could still be asymptomatic and even not have any signs or symptoms of it or even evidence of it on CAT scan until 15 to 20 years after your last cigarette. So very important. Just because you quit a year or two ago, in no way, shape, or form means you're out of the woods.
Right, but it's a step in the right direction.
No question about it.
Thanks, Dr. Soria.
You're
Have a
welcome.
good Thanksgiving.
Happy Thanksgiving, everybody.
All right.